classical and practical homeopathy, okay, this is something that most homeopaths are muddled at. Practical homeopathy is not a methodology. Classical homeopathy is a method, which we teach you at CPH. We teach you all the different methods. Practical homeopathy is a way of applying different methods. So it's multi-method prescribing to suit the needs of your patients. So if your patient comes to you and they've never been well since being on a drug, the cause of their symptoms is the drug. You need to find a method that helps the body to eliminate that drug. Classical homeopathy makes one assumption, is that everybody's ill health comes from the mind. Unfortunately, that is a very limited perspective of health, because there are many people who are walking around who are poisoned by the drugs they're taking, the food they're eating, and the chemical exposure they're coming into contact with. This can all affect your mind. You need to get to the cause of the problem. So you need different methods to do it. So classical method is one method. So if not everybody comes to you with ailments from grief or shock, if their symptoms are coming from an emotional causation, classical method is a good method to use to apply homeopathy. But not all your patients will do that. If you learn one method, your tools and your practice will be limited. You'll have a limited practice. What we teach you is a range of methods and how to adapt those methods to the needs of your patients. That's the important thing to remember, is how you adapt. Classical homeopathy, if you learn one method, your ability to adapt is very poor, because you've only got one tool in your toolbox. What you want is a lot of tools in your toolbox, so no matter how sick your patient is, you know how to adapt to their needs.